As you all know, the International Forum for Promoting Homeopathy has 3 sessions in a row every day. And the first session just over our Hindi session, 7 to 8, and international session in English from 8 to 9, and 9 to 10, we have a local language session in Malayalam. So today we have a wonderful guest in Dr. LEENA VASANT CHHATRE. She has completed her MD in homeopathy, an MBA in healthcare administration, and PG diploma in healthcare. She has an experience of nearly 30 years, and she has some good experience in different areas, particularly public health, health administration, health IT and analysis, clinical research, education, project management, and quality in health. As you all know, there are different subjects we have discussed earlier, particularly the subjects in and around the people that affect during the time of COVID, as well as the things that may happen in the coming days also. Today, our guest will be discussing about current trends, developments in healthcare, and expectations from homeopaths. As you all know that whatever be the things happening in and around the world, we as homeopaths have a duty to bring the best out of homeopathy, and what are the things that we can do for the betterment of homeopathy, and how we can promote homeopathy among people. All these things will be discussed by our guest of the day, Dr. LEENA CHHATRE. Let us welcome our madam to this session. You are welcome, madam. Yes.
Namaste, and good morning, good afternoon, good evening to all. So can I share my presentation, please?
Yes.
So before actually starting to this particular topic, I want to give sincere thanks to the forum to give me opportunity to talk on this subject. Ideally, this subject is not, a clinical subject, so it's a different thing, but I thought it is very important. So I discussed with Sani sir, and as per his discussion with sir, I thought let us speak on this, because there are various things which we routinely do in our practice, and we share various clinical experiences. But this is some topic which is not clinical, but very important as far as sustainability of all of us, including homeopathy, for betterment of public is required. So now I'll start with the presentation, wherein we will touch upon various trends and developments. I'll speak majoritarily on developments in India, but of course with some international developments as well. And what are the expectations from homeopaths, like we all, to actually take up these developments, understand, and work as a team or as a workforce for betterment of mankind. So with this brief, let us start with the presentation. Hope my slides are visible, sir.
Yes, everything visible here.
Yes,
everything.
thank you. Yeah. Just to start with, healthcare infrastructure in India. So it's a known fact for all that principally our healthcare system is divided into public and private system. Public means all government-run healthcare facilities, which includes maybe dispensaries, medical college hospitals, and so many other things as well. Private means all private practitioners and all hospitals which actually provide healthcare to people. In India, there is a typical three-tier system of healthcare, you all know. That's primary, secondary, and tertiary. And as far as homeopathic practice is concerned, most of the practices at primary level. And as far as dispensaries of government are concerned, they are called as PHCs. And all practitioners, generally, they tackle primary care services, or they provide primary care services to people. Now, the unique factor of health infrastructure is multiple systems. So here in India, allopathy is there and various Ayush systems. So Ayush mean to say, you all know that Ayurveda, Unani, Siddha, Yoga, Naturopathy, Sowaripa, homeopathy, of course. Initially, it was called as Indian System of Medicine and Homeopathy, but now it is Ayush. And all these systems are available at public as well as private healthcare facilities. Why it is unique? Because many countries have so many systems, other systems as well, but India has a legal framework and legal, foundations and rules and regulations. So all these systems are governed by some law or a legal infrastructure is there. Now, co-located facilities mean to say that as far as government infrastructure is concerned, in one allopathic dispensary, maybe there are other Ayush systems also. Dispensaries maybe of homeopathy, of Ayurveda. So this is very particular as far as India is concerned, and it started way back as per the cafeteria approach of Government of India. But later on, you know that after NRHM, NHM or National Ayush Mission, this came as one of the key factor for mainstreaming of Ayush. Now coming to current scenarios of health sector with respect to various domains. So these, whenever we are talking of healthcare system, it is not only providing health, but it starts with the education as well, then research, development, drug administration, and other related areas which actually facilitate these functionalities. So whenever we are talking about healthcare delivery system, so all healthcare facilities, maybe from primary, secondary, or tertiary care, they are included here. So we know that the scenario, we need not to discuss the scenario. You all know that what is a scenario. Basically, our health needs are different as far as rural and urban. Whenever we are talking about the urban area, overall healthcare delivery system or available facilities are better. But as far as rural area is considered, there are various challenges. So this is a scenario. Of course, I'm not going in details of each, scenario, but just an overview because you all know. Education, you know, there are so many issues in education, but now currently there are many reforms, especially in homeopathy, and the system is improving. Now, research and development, it is very important because without research and development, no system can grow further. Drug administration, it's not only giving medicines, but it starts with the source material. So quality of source material, then manufacturing and the supply chain, entire supply chain wherein from medicines go to end users, that is patient based on the prescriptions given by doctors. So there are other systems also like quality related issues, maybe related to governing things, maybe practitioners, practices, etc. So these are main domains, and as you all aware that there are various things which still lack as far as going to a particular perfect health system in India. So considering these main domains and the challenges, we can just go to the main challenges faced in India, basically in healthcare, that is access. Equal access are not there. That's not easy to access for majority of people. But of course, in urban, it's better. But when we are considering of rural areas, especially hilly areas and all, that's a challenge. And equity, again, there is, loss of equity, like various areas, there are good number of practitioners or healthcare facilities, and people can opt the choices, but at certain areas, those things are not available. Increase in cost. So whenever we are talking about any healthcare, currently in India, we are seeing that majority of people like to go to private doctors and private hospitals because of various reasons, which we may not go in detail. And that gives rise to increase in out-of-pocket expenditure. And of course, whenever the major diseases or big chronic diseases come, like cancers or cardiovascular disorders, of course, out-of-pocket expenditure, affordability, those things are very important. But of course, there are various schemes, national insurance schemes, but still it is a challenge. Then doctor nurse bed patient ratio. So during COVID time, we have faced this problem. Like there are various things whenever we are talking number of patients or number of needy people and doctors, there is whatever is required, it is not there in India. So that percentage is somewhere less than required. Then increased burden for non-communicable diseases. Of course, considering the current scenario of overall development, we are almost going from developing country to developed country now in a few years from now. So there are increased burden of non-communicable diseases like environment-related diseases, lifestyle diseases, and those like diabetes and hypertension. Of course, transparency is also a challenge, and quality of healthcare or the services, whatever we are getting, or even medicinal products or medicines. So this is also a challenge. So there are many challenges, but I just enumerated a few important ones. So now coming to these challenges, so now the question will be what exactly government is doing for coming out of these challenges. So for this, there are certain policies, and the main important policy is national health policy. So government actually has planned these type of policies, and these are called as national health policies, wherein the overall framing of health education or various domains are done. So in short, the aim, I can just say that to inform, clarify, strengthen, and prioritize the role of the government in shaping health systems in all its dimensions, investments in health, organization of healthcare services, prevention of diseases, and promotion of good health through cross-sectoral actions, access to technologies, developing human resources, encouraging medical pluralism, building knowledge base, developing better financial protection strategies, strengthening regulation and health assurance. So basically it contains everything which is required for any health care system or development or availability of system in India. So now yeah, so now coming to this principle. So basically this NHP, National Health Policy, has main principles. So it is always developed considering these main factors into consideration. So one is professional integrity and ethics, equity, of course, it's required, affordability, universality, and patient-centered and quality of care. So whatever we are doing has to be patient-centered and with a good quality. Accountability, whenever whatever we are doing has to be accountable. The person maybe from teacher to doctor to any paramedics or maybe pharmacist has to be accountable for his or her duty. Then inclusive partnerships. So only government cannot run the healthcare system. So there should be a partnership wherein other players, especially from non-governmental side or private side, should also participate equally. Pluralism, of course, there are so many systems, so choice is offered to people, to patient, and as per their choice and the availability of their own information, they opt for the choice of treatment, maybe allopathy, homeopathy, Ayurveda, and so on. Decentralization, so everything is not governed at center, but it is decentralized, means the power is given further, and generally it is a state, health is a state matter. So the certain policies are developed at central level, but other implementation, monitoring, evaluation, those things are generally at state level. Then, of course, dynamism and adaptiveness. So we have to change as per the requirement. Considering COVID time, we all are aware that like whatever are there, things are there, we need to change as per the thing. And unless and until we adapt those changes, we may not, be successful to provide the healthcare to needy people. Now, these are main objectives. Universal health coverage, it's as the name suggests, you all know, it is health coverage or health facilities to all, equal at various levels, similar type of choices, and with so many other angles. Let us not go in details, but that is a main priority to give universal health coverage. Then reinforcing trust in public healthcare. So various activities for giving a trust factor in public health care system, that is government run health facilities. Then of course, private healthcare sector and public healthcare goals. So unless and until, considering the scenario in India, unless and until private practitioners are onboarded, nothing can be achieved, because majority of care is given by public or private practitioners. So that is also very important here. And of course, there are various targets which are specific quantifiable goals are there. So a few are like life expectancy and various utilization of public health services and so many other things. Now, after these brief, the government is, of course, having some policies. They are, coming with various developments and for bridging the gap between the required thing and the actual need. But of course, coming to so many things now currently, maybe in recent 8 to 10 years, there are many changes. And maybe after post-COVID, maybe last 4 to 5 years, there are various changes in healthcare scenario all over world and as also in India. So now let us go with what are these changes and at what level they are. So now we are talking about the national level changes. First is increase expectations from medical professionals and healthcare facilities from public. So you know that maybe 20 years back, it was very easy to practice for all of us. But now it is becoming bit challenging at some time, because the expectations are more and people are aware of many things. So their expectations are increasing. They are comparing various things. So that's why we are listening, like there are certain things, something happened in some hospital, some mob came, and those things are basically because of increase in expectations, which has just changed maybe since 8 to 10 years compared to previous era. Now, again, people have many choices for taking treatment, not only systems like allopathy, homeopathy, Ayurveda, Unani, but at the same time, there are choices, multiple choices for same system providers for homeopathy, for example. So we are seeing that in big cities, in a main road, there may be 3, 4 homeopaths. So there are various choices. So if some at one particular person, they are not so satisfied, maybe they are not getting good answers or whatever because of their own reason, then they have choice to go to some other homeopath as well. And of course, internet and Google search related knowledge is risky. You all know that whenever some learned, educated person come to you, they have already done their Google search for the particular problem, and they will keep on asking the things like whether doctor, this is a diagnosis, this is a medicine, what should you expect? And they will go on asking the questions. And of course, I'm not saying those things are correct. Google is not always correct, because ultimately physician is the only person who can suggest a right choice or give a proper treatment. But of course, this is also a problem which we all are facing. Then patient rights. Now there are various rights as well as patients are considered. Rights to, prescription, giving prescription, understanding, or maybe there are like medical certificates and so many rights, right to information and giving their correct information, like the details about prognosis. So whenever if patient asks us, we have to give this. Those are rights and has a legal thing. And of course, whenever we are talking about international, there are various rights, and WHO is also working on patient rights and safety in a great extent. Then coming to ethics, medical legal issues and consumer angles. So whenever patients are coming, pehle to it was like people were thinking doctor is a great person and used to get a good respect. But nowadays these things are going towards the consumer side. It is not becoming a, like a typical profession. Doctor is saying something or advising something and patient is listening. So now the scenario is changing. It is like a business wherein patients are like consumers. And of course, with Clinical Establishment Act, wherein various certain things like space, manpower, what instruments you should have, what equipment you should have, and so many things are included. And again, Quality and patient safety. Of course, patient safety is the prime thing. Whatever we are giving, whatever we are treating, has to be safe. Of course, homeopathy has a plus point that what our medicines are generally safe. So, and we are not, actually into various procedures and surgeries and those. So, comparatively, homeopathic systems, homeopathic treatment is considered to be safe. And of course, quality and accreditations like NABH and NQAS, especially for government setups, and NABH at very initially it was only for hospital setups, but now even for private clinics or small clinics, this type of quality certifications or accreditations are there. So basically these things are very important, and initial old days this was not missing, but the trust factor was a major player, and wherein people used to go to a particular doctor, maybe called as a family physician, for years together with a great trust without seeing the quality, without comparing. But now the scenario has changed, and coming day it will change in much rapid way. Then standardization. Then not this standardization is not only to the products, but even processes. So whenever we are talking about the products, like it's not only homeopathic medicines, but it's the our globules or vehicles we call, even plastic bottles or the glass bottles, even we used to give, dispense mother tinctures and all. And most of us, we are using those pudia type of powders, packets, and butter papers. So these all products are actually related to homeopathic practice, and standardization is required. So whenever we want to have certain guidelines, so that's why BIS has started a work related to standardization of these things. And there are various committees. Each Ayush system-wise committees has formed, wherein experts from various domains like education, healthcare administrators, government servants, teachers, and all are coming. Even from the industry side, they are coming together, deliberating on the topic. They are selecting the area for standardization and working on them. And there is a formalized process of working and publishing the standards. And this only will give, the national as well as international recognition for our system. So this is also a main change which is happening, and many things have been started by BIS for standardization. And whenever we are talking about repertories, we have repertories like computerized repertories since many years, maybe 30 plus years. But again, the standardization is required there. So every domain, whatever we are using in our day-to-day practice, needs to be standardized, and the BIS is working for the same. Now, insurance is also very important. Health insurance is one of the emerging field, and majority of people are now covered under insurance, and hence they want some reimbursement from their insurance schemes. So this is also important, and we have to upgrade ourselves for these particular insurance, prevalent era. Now, coming to various other changes like educational reforms, you all know that maybe 30, 35 years, the education was something different. But recently, after National Commission of Homeopathy Act 2020, there are various changes in education. So we can call as educational reforms. Of course, in various other educational ISM system, like and even school and all, their national health policy, so many things are there. So whenever we are talking about homeopathy, of course, there are various changes, and people who are actually with medical colleges, they are aware. And basically, those changes are from a number of teachers, curriculum, there's something dynamic curriculum, then introduction of various topics or the subjects like technology department, then research methodology at BHMS level has started. Initially, research methodology and those topics were or subjects were in PG, but now this is a change. Again, yoga is also there. Then certain elective subjects are there, and like students have to take those subjects and learn. And NTE, again, whenever we are talking about the education system, not only begins with good quality of students, but of course, teachers are very important because they are very instrumental to give the knowledge to young generation, and so that they develop their interest and they can do something in their life as far as practice in homeopathy is considered. So their test or their minimum, like what type of teachers should be there. So that test is NTE is also introduced in this particular, as far as these particular reforms. There are so many other things, but let us don't go in detail because it's a huge topic. But just to mention that there are various reforms and which are of course going towards the positive thing, which are giving standardization of education and giving uplift for the education in homeopathy. Then of course there are various standards and various reforms for medical colleges as well, which also includes number of staff, like their pay and so many things. Then registration of center and state registers. So whenever we get our degree, we are supposed to enroll ourselves in state register and of course in central register later on. So this registration and their norms are also changing. So now every 5 years we have to renew the registration, and there are so many other things as well as far as these registers are considered. Then something called as professional conduct, equity, and code of ethics. So these are also regulations wherein what homeopaths are expected to do as far as having their own professional conduct, how to behave with the patient, what is required and what is not to be done, what is a code, what is ethics, and in which way we have to govern ourselves in our practice is now available with as far as regulations are considered. So initial days, those things were not into black and white things, but now in this current scene, we all have to know about these conducts, ethics, and codes. Then research regulations. So initially there were like so many things are there, but now research regulations are also there, and which basically say what is homeopathic research, who like what is PI, co-PI, and so many things, and how to conduct research, their approvals and clinical research, of course, CTRI registrations, approvals, and so many things are involved. So those all things are mentioned in these regulations. So whenever we are doing any research, maybe in our own clinic or in hospital or it may be a public research, we have to go through these regulations. Then standard treatment protocols. Now CCRH has come up with various things, standard treatment protocols, and recent in WHD they have launched the app also. So whenever we are talking, whenever in national and international forum, when we are talking as a homeopath, people always used to say, oh, they are giving medicine as per their own choice. And of course, the choice is there, which is based on experience and what we can see. It will always remain. But there are some standard ways or major steps which we all to follow, so that people will believe that yes, this is a system and it has a fixed principles, and we have to, and majority of homeopaths are going according to those principles or standards for giving treatment to their patients. Of course, integrative care, you all know now this is an era of holistic care. So it is initially we used to say preventive, promotive, curative, and rehabilitative, but now it's holistic. So of course, which includes all these 4 dimensions, but the holistic era, this particular world or boom has increased during the COVID time, because we learned that the health is everything. Money is not everything, because COVID times, if the health or overall our holistic health or our healthy condition was good, everything went well. Otherwise, people suffered. So holistic health is very important, and to give that integrative care, because all systems have their strengths as well as weaknesses. But whatever as a physicians or as a doctors we are doing in this society, of course earning is one part, but whenever we are doctors, our main aim is to serve society. And whenever we are serving society, we have to be very particular. We have to think patient. We have to give important patient to the patient, and treat accordingly. If patient is coming for certain element which we may not have a good treatment, for example, then we should know where to refer and which system is better. So here in integrative care, wherever in one health facility, patient gets various choices, and based on the need and the disease the patient is suffering, he can opt for the treatment, as well as we can go for referring for the ailments to other systems. So that is a era. So that is very important, and it is an area of integrative care, wherein as various hospitals, Ayush care has also started in allopathic hospitals like AIMS. Now coming to IPHS standards. So recently IPHS Ayush standards have been published. So these standards are very particular, and those are related to 10 bedded, 50 bedded hospitals. But it is those standards are not only how to do the practice, medical practice, but it is with the infrastructure, medicine, equipments, HR policies, what other tools like which we should have for day-to-day, managing the health facility, which may start with the registration, then how the patient sitting area, what should be the area for, the consulting, pharmacy, then essential medicines, and so many things. Of course, monitoring and evaluation techniques and other things are also enlisted there. So this is again a change as far as these standards, especially in Ayush, are considered. Now coming to GMP and Drug and Cosmetic Act, you know that we all are governed by this, and this has really gave a good name and quality for our products, as well as there are certain things which are under Cosmetic Acts and GMP, which we are governing, and we are coming with the good quality products for our people. Then Heal in India and Heal by India is something called as a medical tourism, wherein we are attracting many foreign nationals to take treatment from India. So this is very important. And nowadays, you have seen that the importance of traditional systems now in homeopathy is one of the traditional and complementary system as far as international language is considered. So these systems are getting much popularization, especially after COVID. And similarly, medical tourism or people coming to India for taking treatment has increased manyfold because of trust factor, and of course a proper legal infrastructure of Ayush in India. And hence the Ministry of Ayush has also launched Ayush Visa, which is a specific visa for people who are coming from, or foreign nationals who are coming to India. So they are getting like this visa comparatively easy than the initial days. Then mainstreaming of Ayush, as I said, as far as national health policy, it is like to have Ayush at each and every place. Mainstreaming means initially it was a different part, and allopathy was given a main role. But now it has the world, or even the Indians have understood that if we want to have a healthy life and have a good indicators as well as various diseases are considered, Ayush is very important, and hence the mainstreaming started way back in national health policies. And all these strategies in national health policies are like co-location, essential medicines, and those things have started under mainstreaming of Ayush. Now coming to health programs and National Ayush Mission, whenever we are talking about national health policies, we all know that there are certain programs like, for DOTS, TB ke liye hai, then school health programs, and so many leprosy programs, and so many programs are there, almost lifestyle disorders, and so many programs are there. And allopathy or Ministry of Health and Family Welfare, they are having those under NHM, NRHM, and those things. But now, apart from those programs are basically designed for giving a specialized or focused attention to those disease, and to improve the standards treatment, and even the outcome of for that particular or prevalence of that particular disease. So similarly, National Ayush Mission is one of the centrally sponsored scheme of Ministry of Ayush, wherein the similar things have there are various changes have taken place. Their guidelines are changed, and again, apart from hospitals, there are guidelines and there are certain things wherein certain health projects or national are also included in National Ayush Mission. And there are few maybe a mobile unit, geriatric care, osteoarthritic, palliative cares, and maternal and child treatment. Because understanding the potential of Ayush systems, these national programs have already been included under NAM. So as homeopaths, we have to understand the strength and of our system and what we can really do to achieve these goals as far as our national policies are considered, and actually work for in line with these goals for achieving these targets of health needs. Now, coming to UHCs and SDGs, you know that universal health coverage is as per UN strategy, and there are sustainable development goals. There are 17 goals, but goal 3 is related to health primarily. And these sustainable development goals have further small targets. So if we go through it, we can find out that homeopathy has a great role to actually work here and help our nation to achieve the targets. It is not only achieving targets, but keeping all our brothers and sisters healthy and, to enjoy their health and life for this way. So I think this is important, and we should learn what exactly we should do as a homeopath for these particular areas. Now, apart from these things, we can just talk about, modern technologies and digitization. What has occurred or what has changed recently, which is in line with modern technology or uptake of modern technology in healthcare. So, few main things which I want to discuss with all of you is Ayushman Bharat Digital Mission. It is called as ABDM. It has been already launched. Pilot has also completed, and under that there are various things, but let us think on or let us discuss on these three things: ABHA, HFR, and HPR. ABHA is Ayushman Bharat Health Account. You all know that now every individual can have a unique account for health, wherein he or she can keep all health related records in one. Of course, it's a digital account, and it is linked with other various other things, maybe reports, maybe prescriptions, medicines, vaccinations. So ABHA is important, and this will carry the entire record of a particular individual. So unique health ID, or now it is called as ABHA or Ayushman Bharat Health Account. Now HFR is Health Facility Registry. So whenever we are having a unique ID for an individual, it is not only sufficient. At the same time, other players like health facilities and HPR is Health Professional Registry is also required. So what is health facility registries? All facilities, maybe at primary, secondary, or tertiary level, needs to be registered under health facility registry. And of course, health professional registry, like we all doctors need to register under health professional registry, and also it is included as far as recent NCH guidelines. So why it is required? Because under Ayushman Bharat Digital Mission, this is basically a digital platform, a digital highways they are calling, or a facilitator provided by Government of India for integration of various health records, electronic. I'm talking about electronic health records created at various levels. So whenever we are talking about any hospital, so the beauty of it, which I want to explain in a few sentences, is that because of this, there is an opportunity of sharing the data between various health facilities. For example, a particular patient A, maybe he was having some issue and taking treatment in Chennai for some ailment from Siddha, then transferred to maybe Pune and started taking treatment from some other doctor, maybe allopathy, maybe for same ailment from other, then came to Delhi, started taking treatment from homeopath, maybe a private homeopath or a medical college or so whenever a patient is shifting, his ID is same. But at the same time, these healthcare providers, they are also integrated with HFR and HPR at respective ABDM, the network or the backbone, wherein the facility of sharing the data will be available. But of course, it is not. It is a consent based, because if a particular that patient A wants to share his data to person sitting in Delhi, then he has to give the consent through mobile app, and then all maybe investigations or whatever previous record can be seen by a person sitting in Delhi and treating that patient here. So this is basically a backbone wherein, of course, the data is not shared there, but data is shared to the individual servers of that particular health facility. But there is a exchange of data, or we can say selective interoperability as per the need and as per the consent. So this is the beauty of it. Whenever we are in our clinics, of course, many private physicians are now having their own system of keeping records, and they are using computers and those things. But of course, whenever we are seeing, like initial days, we used to write prescription, and whenever after taking half an hour case and writing some logical prescription after repetization and all, and next time patient used to say, "वो तो पर्चा खो गया." So then we are having nothing. So with this particular thing, we are having everything electronically. Electronic records or personal records are kept, and of course they are not kept with the government, but they are kept with the particular doctor or a particular health facility servers, and exchange whenever required. So this is a beauty of ABDM. Of course, in ABDM, it is not system centric or not primary, secondary, tertiary level centric, but it is for everyone, all Indians. And hence, this is a major big change which has happened. Now, coming to telemedicine, you all know that telemedicine has started growing maybe in last 5 years, and during COVID time, it got a great boom. But of course, whenever as a homeopath, whenever we are giving tele consultations, there are various things which we have to remember. Like few of us may say that आपने तो patient देखा नहीं, you have not seen the patient, but we have prescribed. So there may be some medical legal issues as well, but certainly there are certain standards or the guidelines for telemedicine which are released. So we have to abide by those guidelines, and we have to see there are certain disclaimers also. So we all, whenever we are in our practice, and of course coming days, and especially with Heal in India medical tourism, if we get some patients from India or another cities or maybe outside India, this telemedicine is a great tool for us to continue the follow-up, because every time we may not call patient to a certain, maybe even in India, from one city to another city. So this is a great tool, but of course we have to take the benefit of this particular development, of course, with the certain guidelines and legal aspects as considered. So we have to see that. Now, big data and analytics. So whenever we are coming with the electronic era, there are certain health management information systems which are electronic records, creation of electronic records, and these records are almost related to DigiLocker, of course. So you know that DigiLocker. So in DigiLocker, there is some account which is related to our personal health record, PHR, or electronic health record, we can say. And whenever we are having, initially also we used to have a data, but it was, in hard copies. So it was very difficult to, do analysis. But now, considering the current HMIS and availability of these modern technologies, there is a huge data. So whenever we are having used data, it is a gold mine. So we have to understand what is important, which inferences can be drawn from this data. So proper analytics are important. So players for big data analytics and even analytics as far as our day-to-day data is considered is very important nowadays. Then AI and that is artificial intelligence and decision support system. It's also emerging field nationally as well as internationally. So whenever we are having big data with analytics, there are certain tools which are actually, AI-based tools which help us to diagnose. Or even we all know that like all homeopaths are very modern since many years, because we are having computerized repertories wherein we are repertorizing and automatically we are getting many repertories in one software. And we can taking we have a facility to take rubrics and then having the analysis wherein we are getting the ready-made electronic repertorization sheet. So this is something DSS, decision support system, which means those things are helping physician to take decision. So AI is also increasing. The role of AI, especially in Ayush, is also increasing now. And AI is basically used now for diagnostics, maybe for public health setups, for diagnosis in masses, and so many other things AI is used. And similarly, we have to think now in which way we have to upgrade ourselves to use these techniques for our day-to-day practice and sustain in current scenario. Of course, diagnostics, we are not directly dealing with diagnostics, but of course, diagnostics are there, and when this modern HMIs are integrated with all these things, and various interfaces, like we can send a prescription to SMS, WhatsApp, email, and so many things. And at the same time, there are certain Bluetooth devices like BP instruments and glucometers, which can transmit the data to your HMIs through Bluetooth or various other connectivity issues. So we can actually monitor our patient remotely, and which helps in telemedicine, and also to keep a proper record in centralized HMIS. So these are various things which we have to understand and learn and uptake for our benefit. And now coming to Ayush Grid, it is basically IT backbone of entire Ayush sector. Ministry of Ayush has emphasized this project, Ayush Grid project, for digitalization of entire Ayush sector. The entire Ayush sector means it starts from education, healthcare delivery, then manufacturing, other media outreaches, various other activities, plants, the manufacturing, import, exports, whatever and is available under Ayush, not only for one system, but entire Ayush system is Ayush Grid. And under Ayush Grid, there are various platforms, especially education, like medical college people are aware that there are various things we have to register, registration of students, teachers, then online lectures and repositories, then inclusion of AR, VR, digital classrooms, and so many things are included as far as education is considered. Similarly, HMIS is also there. And this HMIS, whenever it is compliant with ABDM, of course, the data sharing as per the requirement becomes easy. And as of now, it is at the beginning, at the center stage. And now under NAM, this has been offered to states as well. And in due course of time, it will be available to private practitioners and healthcare facilities as well. But of course, here your data is your data. It is always with you. But as per the requirement, you have to give the access to this. Of course, patient will give the access, but you have to have the digital record. We have to create the digital record of whatever we are doing in day-to-day practice. So this grid will also help us to understand various things. And not only this, it will give various educational repositories, books, references, research things, and so many things at one platform, single window. So one clicking and we will get whatever we want, which also includes various mobile apps. And nowadays, you know that mobiles are E or M health is very important. So whatever we are doing has to be with mobile health. So in case of health facilities, if it's a hospital, whenever we are taking rounds, we should have some tab or mobile wherein we can enter the data and it automatically goes to HMIS, and so many things are there and so many developments are happening in this direction. Now coming to coding, so whenever we are registering the patients, there are certain systems, to do coding, or we can say how to classify the data. And that is ICD-10 we used to use, but now WHO has launched ICD-11, and it is a electronic base wherein it can be directly plug in into our HMIs. Of course, Ayurveda, Siddha, Unani have the specific codings for them, and you know that something called as Namaste portal is all launched way back. But of course, now it can be integrated with a ICD-11 because traditional medicine chapter 2 has been released for Ayurveda, Siddha, Unani. But of course, we homeopath need not to bother because we are using ICD coding, same as allopathy. Snowmade City also, because there are certain telemedicine tools or HMIs, especially in allopathy, they are, following Snowmade City type of coding. So these changes are very important as far as modern technologies and digitalization are considered. Now, going through quick international scenario, of course, AI and DSS, modern diagnostic tools are there. But whenever we are talking about AI, it has, many other legal angles also. So each country is actually thinking of having their own law and the way how AI has to be implemented in that particular region. Even India is trying herein. And Ayush is also a part of this particular thing, wherein AI is will be used for various healthcare, maybe in education, diagnostic, treatment, and so many things in future. And of course, medical tourism, emphasis on preventive and lifestyle care has increased. Genomics, which means the genetics and the background of health, with respect to genomics. Of course, we are having similar things like miasm. So we take family history, past history, and so many other things to come up with the miasmatic background. So it is not exactly genomics, but it is similar to genomics. So we have to understand genetics and the role of genomics, and in which way the current environmental changes are, doing changes in genomics, and in which way our medicines can actually, work there and uh, give rise to some good benefit to people. Then now emphasis on antimicrobial resistance, global warming and environmental related issues are also increasing internationally. And so internationally, these things are given more importance to curtail or to prevent and to manage these issues. New diseases are coming, COVID, SARS, followed by COVID, we all know. Then patents, IPR rights are also there. That is also a great field wherein people are taking patents. So similarly, we can also think of having some these type of things in our system. And again, new vaccine, medicine, equipments, techniques, these are coming daily. They are changing and upgrading daily, and increase in the import export of raw material as well as finished goods like medicines and all. It is happening. Then I just want to enumerate something called as GCTM. It is WHO Global Center for Traditional Medicine. It is a main center of WHO. It is in Jamnagar. This is a special center for traditional and complementary medicine. So I just want to say this because this is the emphasis. Now the traditional system of medicine is increasing. The popularity is increasing, and the international organizations like WHO, they are understanding the potential of traditional system of medicine, which of course includes homeopathy, and hence a specific global center has been created for GCTM, wherein focus attention will be given for development of these systems and integration of these systems with research, development, and inclusion of modern technology for benefit of people. Of course, to understand the things, there are various domains. So this is one of the major steps taken by WHO. So with these few international changes, we can just go for expectations from homeopaths. Now these changes are happening. So what exactly we as homeopaths needs to do? Of course, we have to understand these scenarios. We have to have routine updation of our knowledge, not only with of as far as homeopathy is considered, but the current trends, public scenarios, health reforms, accreditations, modern technologies, legal angles, day-to-day changing regulations, because unless and until we know about it, we may not be able to, change ourselves and sustain and, do our services in good and confident manner. Of course, sustainability and competition is an issue. So if we don't uptake those things, we may not be, in the workforce, we will be left outside. So as a homeopath, if we want to grow really for personal level as well as for a homeopathy in general, if we really want to think homeopathy should grow, then we have to think on these angles and understand what exactly we need to do for sustainability. And of course, information of modern technologies, various tools available, uptake, usage, not only just understanding, but usage. Because maybe after down the line of few years, if this HMIS becomes important, because the patient will come and demand for, the records, digital records, then we should have some HMIS. So these things needs to be understood, take up, and of course, we should start using those things. Cross referrals is also important. Understanding the system, our system strengths and strengths and weaknesses, and of other Ayush as well as allopathic systems, so that cross reference shall be done for benefit of people. Then, of course, experience, evidence-based research and practice, whatever we are doing has to be evidence-based. The reasons, because we all deliberated on that. Then involvement in national health programs. For, nowadays, these, especially under NAM, there are various programs. Even there are so many programs in so many years. So we have to, work as a team to include homeopathy there for benefit of people, because we are having various trends, especially maternal and child health and so many things, geriatric care and all. So we should actually think what exactly we should do and contribute for national health programs. Then again, work with experts from other systems. So integrative care is important. So we have to open our doors to welcome all other systems also, and to sit with all of them, and of course with homeopaths and other systems to grow ourselves and also for the benefit of public. Then again, accreditations and benchmarking. Our clinics needs to be accredited. We have to think of the quality. We have to think of quality, giving proper quality care to public as per their expectations. And of course, whatever we are doing is based on the medicines which we are prescribed. So unless and until we are having good quality of medicines, it is, fighting without good weapons. So we have to think on good products and medicines. Of course, it starts from the raw material of and preparation, the process, and again, all supply chain related issues. So medicine should be proper and the quality medicine. So we have to think on those lines. And again, experience sharing is important. So whatever we are getting experience in our day-to-day practice has to be shared. Not only success, but we have to share our failures also. Many times, whatever I may not understand in particular patient, but my colleague can, within 1 minute can say, no, this is this way you can do, or this medicine you can prescribe. So experience sharing in both ways, good cases as well as the failures or the struggles which we are doing in few cases. Of course, creating a repository of successfully treated cases. So whatever in day-to-day life, we all are treating thousands and millions of cases, but we are not keeping the data. But if we keep the data and share with ourselves and public, they will understand the strengths of homeopathy. And at the same time, like we can see the way we are treating, and we can learn from each other the way of treating, way of understanding, and so many things. Again, holistic care has to be given emphasis. And again, with the COVID time, so many things have changed in our lives, but we have to be open to take these changes, to adopt those changes as per the requirement of time and people, so that we can sustain and homeopathy can be sustained and developed further. Then again, now it's a food for thought. I think a literature review with respect to current or latest development. So whatever materia medica, organon we have, we know it's based on, organon is based on, homeopathy is based on natural principles which are not going to change. We are sure and we know about it. But we have to think as far as our medicines are considered, the literature is considered, the provings are considered. We have to think with respect to current era, maybe some provings, maybe the alkaloids of medicines or something, and the latest development with respect to our, so we have to correlate with respect to the latest terminologies. And again, we are basically at primary care. Of course, 90% is required as primary care, even at international level, but we should think of secondary and tertiary care for popularization of homeopathy. And of course, learning strains of other systems and other ways to treat people in a good way with the best possible efforts for popularization of our system. So with these details, I can say, let's think and act accordingly for benefit of mankind through homeopathy. So there are so many things. Of course, there is so many changes are taking place. I thought I will just share few of them. Of course, not in detail because of time constraint, but these things are important. And if we all homeopath actually go through this, understand, it will be really helpful for all of us and people. And of course, we have to think for betterment of homeopathy, in which way we have to uplift ourselves for sustaining the current scenario. So
Yes,
that's all. Thank you.
yes,
Namaste.
yes, Dr. LEENA Chhatre. It's really a magnificent presentation, a powerful presentation, particularly for the development of homeopathy, for the upliftment of homeopathy, and what are the things to be done, what are the things required, what is what, and what is the current trend, and what are the developments happening in and around the world, and what are the expectations, what are the things you expect from homeopaths. That's a beautiful presentation. And anyhow, frankly speaking, we need time for discussion. Unfortunately, our time is about already finished. Anyway, congratulations for your excellent presentation. Hope we can have some more day, some more presentation in the future. And then definitely we can have a discussion for the same. Hope you will be with us in the future presentations also.
Yes.
So I invite Dr. Ram sir to say auto thanks to the session, as the time is already finished. No time for discussion. We will have some more presentation. Hope you can make another presentation for or half an hour. Then we can have a discussion of the same, because it's a wider subject. It's a big subject and
Yes.
need to be discussed. And we need to bring notice of each and every homeopath these things. So definitely, we will upload the same in tomorrow by tomorrow itself in the YouTube, so that more people can reach and understand what is happening with homeopathy in the present scenario of artificial intelligence. Okay, Dr. Ramparesh sir.
Thank you. Thank you, Dr. Dhanesh. Congratulations, Dr. LEENA Chhatre. Very nice presentation. Excellent session. Career of development of healthcare. Very, very thanks. And again, IFPH. Very, very thanks behalf of IFPH. Again, presentation, IFPH. Thank you.
Namaskar, sir. Let us think and work together for benefit of homeopathy, sir. Thank you. Namaste.
Exactly.
Yes, thank you.
Yeah, please wait 1 minute. Tomorrow we will have a presentation from Professor Dr. Ambaram Patel, and Doctor will be presenting about miasm in reality. So with that, we come to the day 1329. It's over to Dr. Shaila to moderate the Malayalam session. Thank you all. Good night. See you tomorrow at the same time.